Hi everyone, welcome to part 4 of Queerspora. Part 4 will cover prevention strategies, good sexual health, and resources. We are so excited to start this webinar by talking about prevention strategies, specifically combining prevention strategies. This refers to the use of a range of risk reduction strategies at different times to reduce the risk of contracting or transmitting any of the sexually transmitted blood-borne infections that we covered earlier. Here you can see some pictures from projectmobilize.org where they discuss using combination prevention. The one in green are effective in preventing HIV transmission. The ones in yellow have a low or uncertain prevention level, and the ones in gray have no direct impact on HIV transmission, but are good to use to maintain good general sexual health. Some of the green colors are treatment as prevention, which is antiviral therapy for HIV. This is TASP. Another great effective green prevention method is physical barrier. Physical barriers are condoms or dental dams, any sort of physical protection. Next, we have PrEP, pre-exposure prophylaxis. Another one is PEP, post-exposure prophylaxis. We already covered PEP, but we will be covering PrEP further in this section. And also, biomed matching is a great green effective prevention method. Some examples of yellow colors are low risk sex, such as oral sex, choosing the right position, such as bottoming or topping, because some positions have a lower risk of contracting HIV. For example, being a top has a lower risk of contracting HIV compared to a bottom. Another yellow color, less effective prevention strategies that we can combine is make agreements with regular partners. Now, this is when you make an agreement to have a regular sex with a regular sexual partner. This way, you can ensure that you're not putting each other at risk since you two are only seeing each other. And some examples of the gray pictures or colors, which means good sexual health but not really preventative, are getting tested regularly and informing your sexual partners about your status. Now, these strategies in combination can be very, very effective. So be sure to access Project Mobilize for more information on these strategies and figure out what works for you. Now, other strategies that are not shown here, but I really want to mention, include limiting all or certain sexual activities to partners whose HIV status is the same as your own. And this is known as zero sorting. Another one is withdrawing the penis from the mouth, vagina, and anus before ejaculation. Another one is choosing to adapt sexual practices with the lowest risk in situations where the possibility of transmitting HIV is unknown or high. For example, fingering, mutual masturbation. Another one is choosing to limit the number of sexual partners you have. And finally, another one is choosing to refrain from sexual contact on a short term or long term basis if the conditions are not optimal for reducing your risk. Again, these prevention strategies were taken from Project Mobilize, so be sure to access their website for more resources. This is another amazing tool and resource that you can use. You can actually calculate your risk of contracting HIV. You can access Health Initiative for Men at the link provided for you on this slide. Now, you can input your information, for example, the kind of sex you're having, are you HIV negative or positive, and what the status of your partner is, and all the other different variables. And this calculator will assess and calculate your HIV risk. And it's a good way to gauge and get understanding of where you stand in terms of the HIV risk contraction. We also wanted to share this resource with you that can be found on Katie's website. In their Safer Sex Guide, you can learn more about HIV prevention and detection, using condoms, and using drugs while having sex. It is a simple read with lots of colorful and bright images, so please access the link provided for you on this slide. PrEP is another HIV prevention tool, and if you can remember a few slides ago, it was in the green section, so it's pretty effective. Studies have shown that this kind of prevention method, or PrEP, can help prevent the transmission of HIV of up to 98%. Let's watch this video to learn more about PrEP. However, before we start, I would like to mention that PrEP is normal, and it's a common drug to take for those engaging in oral and or anal sex, such as gay and bisexual men and more. Let's watch this video now.
What if there was a pill that could help prevent HIV? PrEP stands for pre-exposure prophylaxis. You may have heard this referred to as Truvada. PrEP is a medicine which can be used by HIV-negative guys who want to reduce their chances of acquiring HIV. PrEP can be a good fit for guys who occasionally use or don't use condoms at all, guys who have HIV-positive partners, or sex workers. If it's taken daily, PrEP is highly effective at preventing the acquisition of HIV. Once you begin taking PrEP, it takes some time to become effective. PrEP takes longer to achieve protection in your vagina, about 20 days, than it does in your ass, about 7 days. HIV works by entering immune cells and making copies of itself. But PrEP prevents the virus from making copies of itself, limiting your chances of acquiring HIV infection. Remember that PrEP does not prevent you from acquiring other sexually transmitted infections, so if you want to prevent STIs, combine PrEP with a condom. PrEP requires a doctor's prescription and an HIV test to show you're HIV negative. To help make sure PrEP won't be harmful to your body, let your doctor know if you have any kidney issues or if you've been diagnosed with hepatitis B. PrEP can be expensive, but it is covered by some health insurance plans. Speak with your local ASO or healthcare provider to find out what's available to you. If you're neg, PrEP might help you avoid HIV and have the sex you want. For more information on PrEP and how to get it, visit thesexyouvant.ca.
That was an excellent video. I hope now it's clear the difference between PrEP and PEP. PrEP is usually taken by negative status or HIV negative status individuals, and PEP is usually taken after the contracting of HIV. Now let's watch a video on condoms. Condoms are a great and easy prevention method that should be used. Let's watch a video to get a better understanding and learn more about this amazing prevention technique and its benefits.
Condoms are cheap, and they work. You can even grab them for free at some sexual health clinics, bars, or bathhouses. A condom is a thin piece of material that either fits over the penis or inside the ass or vagina. When used properly and consistently, condoms are very effective at reducing the transmission and acquisition of HIV and STIs such as syphilis or gonorrhea. To be effective, condoms should be used before any sexual activity begins. A new condom should be used every time you have sex, including when you stop and start, switch positions, switch partners, or are sharing toys with your partner. There are two types of condoms, ones that go on you and ones that go in you. External condoms go on things that are hard, like penises and sex toys. Internal condoms are for bottoming and go inside your ass or vagina. Not all condoms are created equally. There are different sizes, thicknesses, sensations, and textures. It's important to find the right fit for you. Flavored condoms should only be used for oral sex because they tear easily. Many condoms come pre-lubricated, but more lube is always needed for anal and vaginal sex to reduce the chances of internal tearing or condom breakage. This can also increase sensation and make the sex you're having feel better. Condoms have no medical side effects, although some people are allergic to latex, so it's important to get a condom that's the right material for you. Some guys have difficulty keeping an erection when using external condoms, so they use a cock ring to stay hard, or they use an insertive condom with their partner. There are also medications that can help. It's important to remember that condoms have expiry dates. Never use an expired condom. When it comes to condoms, 2 is not better than 1. Never use 2 external condoms at once. And don't use external and internal condoms at the same time, because the friction will cause them to tear or slip off. For lots of guys, condoms give them peace of mind. and are a really great way to have the sex they want. For more information on condoms and lube, visit thesexyouvant.ca.
Awesome. That was an excellent video. Before we move on, it is important to talk about party and play. This may be a phrase that you have heard of on a gay dating app or in person. Party and play basically means using drugs to enhance or facilitate the sexual experience. Common drugs include crystal meth, ketamine, poppers, and MDMA, but there are many more out there. There is nothing wrong with party and play. If this is something that you would like to do or engage in, feel free to do so. However, please be careful and make sure you are taking all prevention precautions when doing so. For instance, do not share needles when injecting drugs, and be sure not to exchange bodily fluids such as blood while engaging in party and play. Finally, be sure to remain conscious during party and play if your intention is to have sex, and remember to use a condom if you are high or under the influence, especially if you do not know someone's HIV status. Now it's time for another quiz question. Which of the following are prevention strategies? You can read the options provided. I will give you 3 seconds and I will move on. If you want more time, pause the video now and come up with your answer. 3, 2, 1. Okay, if you answered all of the above, you are correct. These are all great preventative strategies that can be combined even, and they include condoms or dental dams, washing or showering before sex, taking PrEP, cleaning any sex toys that are being used, doing oral sex if there's a high HIV risk involved, not sharing any drug equipment, like we said, needles not being shared, talking to your partner about your status and how you feel and what kind of sex you want, getting tested regularly, and also biomed matching. And this basically means when you're matching with the same status as yourself. Okay, now let's talk about good sexual health practices. Good sexual health is easy. Some steps include and include changing the way you use drugs and alcohol or before or during sex in order to have more control over the prevention strategies you put in place. So be sure to monitor your drug and alcohol use. So that way you are not under the influence too much, and you're conscious and you remember to use a condom or take whatever safety precautions you need to take before having sex. Number 2 is getting tested. So get a test or physical examination on a regular basis. And this way you can detect the presence of STBBIs, which is sexually transmitted blood-borne infections, and initiate appropriate treatment at the right time. Number 3 is discussing your HIV status or the strategies that need to be put in place with sexual partners prior to having sex. Number 4 is informing your sexual partners if you have an STDVI or HIV before you have sex. Number 5 is using social and health services, and this can be for your sexual or physical health along with your mental health. And number 6 includes considering to keep track of your doctor, clinic, and test visits, as well as some of the contact information of the people you have sex with, just in case you have to notify them later if any news or update occurs regarding your sexual health and HIV or STBBI status. And this could be like a fuck buddy calendar or notebooks or even a little note section on your phone. Another big component of good sexual health includes looking out for yourself. All the information that I will be talking about from now on is referenced from the sex you want. Firstly, think about the sex you are going to have. This is the first topic or one of the topics that From the Sex You Want talks about. You can ask yourself a few questions such as, what does the sex that you're having normally involve? Also ask yourself the strategies you're using for good sexual health. For example, does your sexual health look like using condoms? Does it look like using PrEP? Does it look like having one regular sexual partner? These are good questions to ask yourself. Also, you can ask yourself, are you a bottom or a top? Do you know which position has a higher risk of contracting HIV? You can also ask yourself if you want to stick to oral sex and one regular partner, or do you want to have anal sex with multiple regular partners? It is all up to you. The questions are endless, but make sure you think about the sex you're having and know what makes you happy and where you stand. The next topic is checking in with yourself. There are many ways to do this, and we all could do this because it helps us understand what we want and what we don't want from our sexual encounters. For example, you can ask yourself if you want to do drugs or drink alcohol before sex. You can ask yourself, is that a good idea? Can you handle the amount of alcohol you're drinking? Do you want to have sex later? Is it safe for me to have alcohol and drugs right now in this environmental setting? These are good questions to check in with yourself if you find yourself in a situation where you are drinking and doing drugs. Also, let's say you are having sex and someone asks you to do something that is very uncomfortable for you. It is important to check in with yourself and ask yourself if you want to do this before proceeding. This is all right, even if you said you wanted to do it before, but you change your mind later. You need to be able to check in with yourself and know what you want and be able to communicate it effectively to your sexual partners. That way, you feel safe and you are safe. You can also ask your sexual partner questions such as, what are you looking to do? Or you can ask yourself if you want to go in the back room of a bathhouse and see what happens and see if you're ready for it. That way, if you ever find yourself in a situation where you're a little confused, you can ask yourself these simple questions, checking with yourself, your sexuality, your desires, and what you want, and also your safety to make a decision. Finally, disclosing basically means sharing information. Now, disclosing is one of the last topics that From the Sexy One talks about, and we want to highlight this as well. You can choose to share your identity, gender, sexuality, your relationship, your HIV status, your personal life, whatever, to who you want and to whoever you want and when you want to do it. No one should force you to tell them. Finding the balance between honesty and privacy is ideal, and it's different for everyone. It is up to you to find this balance and find out what makes you feel happy. It is important for two sexual partners to have an honest conversation about the topics that matter to each other. This way, it is easier for you to know what your sexual partner wants to know, and so you can tell them. When you're talking about HIV, it can be hard for HIV positive individuals to disclose their status and information. And this is because of the stigma and the stereotypes around HIV. Therefore, it is up to you to disclose this how you want to, and when you want to, and to who you want to. You can ask yourself a question, for example, do I trust this person I'm talking to? Should I tell them that I'm HIV positive? Do I need to tell them? These are good questions to ask yourself. Now, when it comes to having sex, you can also ask yourself, are we having sex? Are we going to use condoms? When is the last time I got tested? Is there a risk I can give someone an infection? Or is there a risk that they can give me an infection? Do I know how to explain my status and my concerns? These are great questions to ask yourself when it comes to disclosing information, because you may want to know something and your sexual partner may also want to know something. So be ready to talk about this and disclose what needs to be disclosed. At the end of the day, it is very important to be direct and clear as possible when communicating with your sexual partners. This is part of effective and clear communication. Again, these topics and the information that was presented to you was referenced from the Sex You Want website and resources. Please access the website to learn more. Let's move on now. Good sexual health also includes your mental health. It is very important for us to take care of our mental, spiritual, and emotional health. This is because the LGBTQ2SA+ community faced and even still faces a lot of discrimination. And there's also a lot of homophobia that still exists. This can all lead to internalized homophobia. This is when members of the LGBTQ plus community internalize society's negative comments or discrimination towards their sexuality. So be aware of this and be sure to ask yourself if you're going through internalized homophobia. And if so, be sure to seek help or talk to a friend or even visit sexual health centers and resources such as Max Ottawa for mental health resources. Now, the effects of internalized homophobia include mental distress, mental health issues or depression, decreases in the quality of sexual and intimate interactions and relationships, isolation, shame, and low self-esteem, and secrecy and dishonesty. So if you ever find yourself going through these signs or symptoms or having these experiences, you may be dealing with some kind of mental health issue or you may have internalized homophobia. So please reach out and seek help. There may also be cases when you may feel conflicted with your religious identities or cultural standards and your sexuality and sexual identities. This is normal. If you feel that it is impacting your mental health, please access Max Ottawa website to speak to someone and for more resources. We're here to help you. However, for now, let's watch this quick and easy video to learn more about 10 ways to maintain your mental health, because mental health is very important, especially when it comes to the LGBTQ2SA+ community. That was a great and easily understandable video. So please be sure to take care of your mental health. You are not alone. Now it's time for resources. If you're looking for resources and you're looking for places to get tested, well, firstly, always access the Max Ottawa webpage and also the resources mentioned before, such as From the Sex You Want, Katie, and Project Mobilize. However, Other places to get tested and obtain resources that are quite local to Ottawa and maybe close to you include Gay Zone, free and anonymous HIV testing, which is at 420 Copper Street, Ottawa. Sexual Health Clinic at 179 Clarence St. Street, Ottawa. Somerset's West Community Health Centre at 55 Eccles Street, Ottawa. University of Ottawa Health Services at 100 Mary Curie Private, Ottawa. You can chat with sexual health clinics. You can visit the Ontario HIV and Sexual Health Info Line at 416-392-2437 or 1-800-668-2437. And they include services in English and multilingual lines. The Sex He Wants is also a great resource we also mentioned previously with the link provided. Katie is another great resource we often reference to throughout this presentation. And also, you can visit Gay Men's Sexual Health Alliance. Queerspora also developed an amazing resource for you with more information on HIV prevention techniques, other STIs, newcomer help and settlement services, health services, employment resources, language classes in schools, socializing and entertainment options and resources, and much, much more. This amazing resource is available in English, French, Spanish, and Arabic. Be sure to check it out on Max Ottawa's Queerspora webpage. It's very, very informative and it's easily maneuverable. Okay, well, it looks like we have come to the end of our Queerspora video-based webinar. From the bottom of our hearts, we really hope you enjoyed this webinar and learned a lot about sex and its benefits, communication and consent, common STBBIs and symptoms and treatments and testing, and sexual health and prevention techniques. We wanted to remind you to love and enjoy yourself, communicate effectively with partners, balance and estimate the risks you are exposed to with regards to STBBIs and HIV, apply combining prevention strategies to your everyday life as part of good sexual health, and get informed and educated about HIV and STBBIs and get tested as well. And also, remember to visit your local sexual health centers and clinics and other resources that we shared previously for more information and also to get tested if you ever need it. Finally, if you are a newcomer to Canada and have some burning questions, please reach out to Max Ottawa via info@maxottawa.ca or Mohammed@maxottawa.ca. Their emails are listed on this page. Thank you. Have fun, but most importantly, stay safe. Bye.